this is Dr. Cidambi. I am today going to talk to you about this phenomenon, which is called thought broadcasting. So what does that mean? You ever get this feeling that someone can hear your thoughts? They're just right there, even though they are not there. That's actually, it sounds weird, but that's actually something that people really experience. Let's really talk about what is thought broadcasting. It's more common than what you think, especially for those who are suffering with various mental health conditions. It's a key to help people if you don't understand. Empathy is the key element to understand them and to help them. There are three core beliefs. The thoughts are being sent outwards like a radio signal. The second, that people can hear them. So the third is the big one, that these broadcasted thoughts can influence others. That's where the anxiety kicks in. That feelings of vulnerability, losing control of your own, and being in that mental space, it's super uncomfortable feeling. There's a mental telepathy where you're convinced that someone is literally reading your mind. It's like the thoughts are spreading out like ripples reaching everyone. And the thought insertion is another one, when you have this feeling that you're receiving someone else's thoughts. That could be more disturbing. Not even your own mind is safe. And it could be debilitating. Like this one story where the young man describes this, his thoughts are in a glass box. Everyone can see, but he cannot contain them. It's hard to connect with people, afraid to speak up, afraid to share opinion, always second guessing. It's always self-monitoring that others might be hearing them. It's what's going on in the brain to cause this. It all comes down to the brain and how it handles information. Thought broadcasting is not a condition on its own. It's often a symptom of something else, like schizophrenia. Schizophrenia, especially the paranoid type, that's a strong link. And also we see it with anxiety, depression, and even trauma. So many different pathways, but physically in the brain, what's happening? We have different areas in the brain, the frontal cortex, the temporal lobe, the amygdala. These handle our thoughts and emotions. When those get disrupted, maybe the neurotransmitter imbalances, dopamine or serotonin, it can totally mess with our thoughts. So the communication breakdown with our brain. The brain is like a highway system. The information is zipping along this road, and the information is talking to each other, the neuronal network. But the stress or trauma or information get lost, and this is like unusual thought pattern. So it makes sense, right? So it's not just the event, it's the impact that it has on the brain. And even years later, that this is heavy stuff. What can be done for someone who is struggling with thought broadcasting? It's so hard to live with. There's a lot that we can do. Therapy is a big one, of course. And there are coping strategies that you can really make a difference. So when I say therapy, there are many types of therapy, and which one works the best for that person, it is individualized. So one that often is a starting point is the cognitive behavioral therapy, CBT. So changing the negative thought pattern, recognizing those distortions that fuels the anxiety, and thought broadcasting, CBT really helps someone reframe those thoughts and see them as just thoughts and not necessarily true. Not suppressing the thoughts, it's just changing the way you relate to them. And that can be incredibly powerful. And there are others like psychodynamic therapy that digs deeper into your emotions, and then group therapy, family therapy. And so these are this whole toolbox of options. But what are those coping strategies? Things people can do on a daily basis, day to day, to manage the anxiety, the distress. So deep breathing is a huge thing. Mindfulness, meditation, progressive muscle relaxation, those can really calm your nervous system, and you feel like more under control, like yoga, journaling. All of those, you would wonder how these small things can really help. Even if you're not in therapy, these things like coping mechanisms do help. There are cognitive remediation therapy or CRTs. That one focuses on the cognitive skills and the metacognitive training that helps people more aware of their thinking processes, and acceptance commitment therapy, which is the ACT, accepting those tough thoughts instead of fighting them. The EMDR, eye movement desensitization and reprocessing, that's specifically used for trauma processing. How is this tied into thought broadcasting, right? Trauma can really mess around with the brain. The neuronal connection very early can really get messed up. And so it can really lead to the thought broadcasting. So everything is interconnected, right? It's fascinating. The brain is a fascinating organ in our body. The brain science and the whole range of treatment. We talked about all these. And so we are talking about how trauma can affect the brain, and EMDR is it's a fantastic one. It uses bilateral stimulation. So bilateral stimulation, it could be eye movements or even tapping and even sound, stimulating both sides of the brain. And that really activates different areas of the brain, and to be able to rewire the brain and process information in a much better way. So the trauma can sometimes contribute to thought broadcasting. And dealing with this trauma is very important for healing. It all comes back to one thing, the mind-body connection. So what is readily available? It's a relaxation. They're super helpful, they are really headspace, calm, insight timer, mindfulness and, mindfulness guided medication, breathing exercises, and, calm and well-being tools are very helpful. And you can use them anywhere and anywhere. These are the apps that you have, and even at a very crazy day at work, you can use them. There are so many apps. And people who are dealing with thought broadcasting, managing that anxiety is key, because that anxiety, it fuels those thoughts, the feelings of the vulnerability. It's a vicious cycle. That anxiety makes the thought broadcasting worse, and then that creates more anxiety. So that's why the relaxation technique and the mindfulness will break the cycle. Even taking the deep breaths is amazing how powerful it is. It's all about the mind-body connection, being in the present moment, and really it helps you calm down. You're putting that pause is important. It creates a space for self-awareness. In that space, you can start to observe your thoughts and without judgment, and you just see them as thoughts, and not necessarily the reality. It's not the reality. You are changing the relationship with your thoughts, cultivating the understanding, recognizing that it is an unsettling thoughts. They're part of human, and takes away a lot of shame and fear. It opens a door for self-compassion. Imagine treating yourself with the same kindness that you give to your friend, where you offer that to your friend who is struggling with stress. So self-compassion creates a safe space within yourself, so you can navigate yourself through this struggle. So always learning and evolving is important, and it's seeking support is excellent. Just whether you're talking to someone or reaching out for help, going for therapy, it can make all the difference. So explore the emotional side of thought broadcasting. So coping strategies, so what is next? What else are we going to talk about? It's a personal experience of, so the bigger picture of mental health awareness. So remember, thought broadcasting is a symptom, not a condition on itself. It's often linked to other mental health challenges. So mental health is complex. There is no one size fits all. I keep saying this, but to keep the compassion and make it very safe for people to be able to share their experiences. That's important. On that note, I say bye to you guys, and I'll be back with one more topic soon. Thank you.